It's time to rock and it's time to roll. That's why we're doing this together, Lisa. So thank you for the opportunity. Good evening and greetings, everyone. We are delighted to be in community with you today. Welcome to the first 100 days, policies, priorities, and power. And our power, more importantly. I am Tiffany S.W. Hamilton, CEO of the YWCA of White Plains, and I am excited to co-host this important conversation today because, honey, these last 100 days have been more than a news cycle. They've been a blueprint, they've been a warning, and they've been a call to action. Hello, somebody. So we've seen decisions made that shape our rights, our health, our economic security, often without us in the room. But on tonight, we are in the room. We are in the right room. This is our space to unpack, to connect, and most importantly, equip ourselves. And let me pause for station identification. The chat is wide open. Check in where you're from. If there's something that you agree with, give us a hello. Ashe, it is so, because this is our community. Let's be real. Black women in our communities are often the first to feel the impact of policy shifts, but too often the last to receive the resources or respect we deserve. But guess what? That stops here, and that stops now. On today, you'll hear from people who know the stakes and who are doing the work. Doctors, doulas, policy advocates, organizers. They'll share not just what's happening, but what you can do about it. We already saw someone check in with some resources popping on Saturday or next Saturday. Scroll up in the chat if you missed it, because what this is not about fear. It's about clarity. It's not about helplessness, it's about power. So as you listen in on tonight, I ask you to do three things: engage fully, take notes, drop thoughts in the chat, bring your questions to the chat. But I also want you to think locally. How does this show up in your zip code? And what can you actually shift? And then I want you to leave with a plan, because there's nothing more dangerous than a Black woman with a made up mind and a plan. Hello, somebody, because awareness without action is not enough. So we're not just here to break things down, we're here to build something up, a movement grounded in truth, care, and community. So without further ado, I want to bring my partner in power to the stage to bring forward our official introductions and level setting. Lisa Cunningham, interim co-president and executive vice president of marketing and communications for Black Women's Health Imperative. Lisa, the floor is yours.
Oh boy, how can I follow that, Tiffany? Oh my goodness, you showed up and showed out already today by giving us that powerful intro. I was thinking about this day as I was literally on the Hill today, on the state capitol. We were there with our Rare Disease Diversity Coalition, prepared to keep our issues front and center. And then I said to myself, this is my official first day on the job as interim co-president. And I look back on this incredible legacy that Linda Goler Blount, my friend, left us. I mean, I got to keep it real. Our doors probably wouldn't even be open right now if it wasn't for Linda Goler Blount, because she had a vision for our future. And one of the reasons, and probably the most important reason why I even joined up and signed up, and as I like to say, drank the Kool-Aid of the Black Women's Health Imperative, is because of my shero, Billie Avery. Billie Avery, our founder. I don't know if everybody on this call knows this, but Billie Avery founded our organization in 1983 on Spelman's campus. She thought she might get a couple of hundred people to show up. She got 2,000, you all. That was before social media. Understand that, right? And so Billie is also very active in our organization today. She's on the line tonight. And what I want you all to know is that this truly is an intergenerational conversation. We're going to stop the bickering between the silent generation, Generation X, the boomers. That stops now, because this time is too crucial. And so I was tapped in by our amazing board, and I hope some of them are on tonight, as I know they are. And I was tapped in, but not by myself. I also have a co-interim president, and that is Michelle Minus Swittenberg. And so I'd love for her to just say a couple of thoughts.
All right, someone else has, okay, got it. All right, here I am on camera. So would like to welcome all of you and thank you for being part of this very important gathering. As Lisa said, today we're not talking about the first 100 days, but we're really carrying forward a powerful legacy. When Billy founded BWHI, she knew that women's voices, Black women's voices, health and lives were being left out of the conversation, and she knew that we deserve better. She built a space where the truth could be spoken, where our experiences could drive solutions, and where our collective power could ignite change. Tonight, we gather in that same spirit. We are here to face the critical issues facing Black women and that are currently under renewed attack, and to make it clear that we will not be silenced. But we also need to be aware of the financial battle that's taking place behind the scenes at many of our organizations. Intimidation tactics are being used to scare funders from supporting health equity and other topics related to race and gender. We have felt it firsthand here at BWHI. Some funders who once stood with us and with organizations like yours are now stepping back and choosing comfort over courage and silence over solidarity. But we're going to be clear and we're going to speak that truth tonight. We are not stepping back. We're not going to stay silent, and we're certainly not going to slow down. At BWHI and right here in this town hall, as you'll hear from all of the wonderful speakers on these panels, we're going to continue to move forward with urgency, clarity, and with unwavering courage. So I want to welcome you and thank you all for being part of this conversation, and a special thank you to all of the panelists who I look forward to meeting in the coming months. So I'm now going to turn it over to fellow members of the BWHI staff who focus on policy, Ife Udo and Candice Bond-Tiro.
Yes.
Hello, hello. Good evening, everyone. It says I'm unable to start my video. There we go. Here we go. There we go. Pleasure to be here with you all. I'm so grateful to be in community with this amazing panel of women, but also in community with all of you all who are here for the call to action, for how we address and keep in joy and how we address and keep in action in these deep policy times that are impacting our health. My name is Ifoma Udo. I'm the Executive Vice President for Policy, Advocacy, and Science at the Black Women's Health Imperative. I will not spend too much time doing too much talking because we really want to hear from you all and our panelists. We've got an amazing group of people here to speak with you all today, but I definitely want to give a shout out to our Policy, Advocacy, and Science team, our leaders who stand on the front lines in this work, Candice Bontario, who is our Senior Director for Policy, who has joined our team, Dr. Janae Epps, many of you know her on this call, our Senior Director for Reproductive Justice is here on our team. Dr. DeBrand Tarver, our newest member of our team, senior team at the Policy Advocacy Science, who leads our research initiatives around cancer. It's just such a pleasure to be here in community with so many of you, my team, our partners, and thank you for your time, thank you for your commitment, and turning it over to you all to continue the conversation. Thank you.
Good evening, everyone. It's really nice to be in space with you. As Ife said, my name is Candice Bontario, and I use she and her pronouns, and I'm calling to you from Northern Virginia. And Ife and I have been working. We have been on the Hill, pounding the pavement all week to make sure that our voices are heard and are a part of the conversation from the beginning. And for me, this work is both professional and personal. As a mother of two, I really believe in the power of ensuring that generational health is actually secured for Black women and girls. And I just want to very quickly just talk about our 5 policy pillars that we're very excited about that will be leading our work in the next few years. The first one being access to quality and affordable healthcare. We all know how important that is, and we all see what has been happening in the last 100 days, and we need to make sure that we keep up the fight, because we need to make sure that our people have access to affordable and quality healthcare. Secondly, we focus on healthy families and children first, which includes our maternal health program, where we are really excited to ensure that we have a perinatal workforce and that we retain them, because we know how important doula care is for our Black mamas out there. Thirdly, we focus on equitable governance and relationships, because we know that we have to be collaborative across coalitions, with policy partners, with stakeholders, with members of Congress in order to really get this work done. Fourth, we care about employment and educational equity. As an adjunct professor myself at Howard University, HBCUs are our heart. They're our heart. They're our life's blood of our community. And we want to make sure that HBCUs continue to thrive and continue to educate the best and brightest. And finally, technology access and artificial intelligence equity is really important to us, because we know there is a digital divide. We know that in rural areas, everyone can't access this call. People are not able to log into this webinar to discuss 100 days and be in community with us because they do not have broadband internet access. We also recognize that AI is not going away. It's here to stay, and we want to make sure that our people actually understand how to use it and how it can benefit us when we talk about diagnoses and ensuring that healthcare is actually accessible, and making sure that we are all connected and that we all learn the technology that is coming. So with that, I will hand it back over to our newest leader, Lisa Cunningham.
It's going to be me and Tiffany for the rest of the road with all of these amazing folks that are going to check in. Who's checking in first, Tiffany?
Listen, we have everybody from across the country, and I'm going to take a personal point of privilege and shout out to the Midwest. St. Louis is in the building. I saw that. I'm originally from Kansas City, so definitely had to lift that. I saw Chicago, Northern Virginia, Philadelphia, Atlanta. Everyone is in the building. But now I believe we're ready to transition to check in around reproductive justice a little bit. Are we ready for that ride? If you're with me, I can hear y'all, even though y'all on mute, okay? And so we know that sometimes it's hard to see the direct impact of the rollbacks that are taking place in the reproductive justice space. And so I know that we have the amazing president and CEO of In Our Own Voice, Regina Davis Moss, with us. And so I would like to bring her to the stage to check in, to walk us through what we're experiencing currently around equity in reproductive health and public policy.
Hello, and first of all, let me just thank you for bringing us all together. This is so powerful. I see hundreds of people on this call, and that's what we need right now, to be in community with truth, justice, power. In Our Own Voice is a powerful network of Black women-led, Black women-focused organizations that are fighting against this devastating attacks on our reproductive and sexual lives. So what are we seeing right now? We are seeing abortion bans. We are seeing, our healthcare, access to healthcare just be, ripped away from us. We are seeing DEI and all these other attacks. And, one thing I just want to make sure that we take away from this is that this is completely about control. This is not based in science. I don't have to tell you that. This is any sort of narrative around this is protect life. I want you to counteract that, because that's dangerous and it's false. The data is showing that restricting access to reproductive care leads to the higher rates of maternal mortality. I mean, we've got the receipts on that. So I'm looking forward to this conversation. I just want to say that I don't have to tell you all what the ripple effects of all of this bad policy is. I mean, it's just, our communities are already burdened by systemic inequities, and now we're going to even face greater barriers when it's coming to access to providers. It's just a bad situation, but I am hopeful, because I know that we are going to rise up as we always do. We always have to sound the alarm before it gets to crisis, portions, but at the same time, we've already sort of figured out what needs to happen. So thank you so much. I'm looking forward to this great conversation, and I'll turn it back to you.
Regina, I wanna, for anyone who does not know the depth and breadth of In Our Own Voice, can you please share that with them and let them know about that coalition, which may be in many of their cities and is just really, quite frankly, nationwide? Let them know about it.
Yeah, let me just back up a little bit to just say what reproductive justice is. So reproductive justice is not reproductive rights. It is not reproductive health. Reproductive justice goes beyond the legal right to abortion. It's about whether people have access, resources, and power to make decisions about their reproductive and sexual lives. So it's not just about whether or not you can have a baby. That's important because we want to be able to have babies, especially when they try to, sterilize us. But it's also about, if we decide to have an abortion, being able to do that without shame. If we are gender expansive, if we have, whatever our sexuality, our right to sexual expression, our right to sexual pleasure. So it is all of those things. And the 12 partners that we work with across 11 states, some of them are on this call. KR is here. I saw Dazon in the list of attendees, and I apologize if other ones came in, but that's what we do. We're in Atlanta, we're in California, we're in all the communities where Black women, girls, and gender expansive people need us most. And we're there because, it was created by us, for us. And most important, we are championing policy change and shift because we know that's when we get the policies that center our lives, that reflect our values, of course, we fare better, but honestly, everybody fares better. So this is the work we do. We release a policy agenda. We're going to be releasing one in June, ahead of Juneteenth. We release polling, and I'm telling you, this polling, we've been doing it for 10 years, and it's, some of the most robust polling, because when we say this is how Black women feel, we absolutely mean it because it's all Black respondents. And so that'll be coming out this year. We got some great stuff coming up. We're coming together in a couple of weeks to strategize on what our plans are to fight back. We're in the states right now. We're going to normalize the good policy so that the other side doesn't just make us, just make us exasperated and say, okay, put our hands up and say, okay, there's nothing I can do, because there is something that we can do. Because the last thing I would say is we are very clear that Black women are the largest voting bloc in the American electorate. That's how we vote in the policy makers that are going to pass good policy. And so we need to use that to our advantage. And that's what we're all about, is building a movement.
That's awesome. Thank you for sharing that. And a couple of nuggets, if you are following along, in the policy agenda should be coming out in June. Some real polling will be coming out in June. And so we want to make sure that we're sharing those facts, that we're digesting those facts. And one of the things that we know about any movement, it being intergenerational, is a clear sign of effectiveness. And so I want to bring to the stage Dr. Crystal Redmond, Executive Director of Spark Reproductive Justice Now. Dr. Redmond, tell us a little bit about your organization and its power and position in mobilizing the youth as a part of this movement.
Absolutely. Hi, everyone. I'm KR, pronouns they, she, and Spark RJ Now is located in Atlanta, Georgia, although a lot of our work is broad throughout the Southeast region. And as Regina said, we're a partner within Our Own Voices, and because of that partnership, we're able to have a national reach, which is amazing. And I believe Regina shouted out Dazon Dixon, who is with Sister Love, is right down the street from Spark. So Dazon does amazing work at Sister Love, just with HIV and reproductive justice. And Spark specifically, we center our work on Black women, queer, trans, gender expansive folks, specifically BIPOC, young folks who are queer, trans and gender or gender expansive in the South. So some of the work that we do directly grassroots is around power building and shifting culture shift work, really engaging in the legislature. But outside of that, a lot of our work is on communal care. Like, how do we hold folks as a source of power? How do we build collective power, mobilizing and moving folks not only to the polls, but outside of that, we understand that, we're abolitionists at heart, and our work speaks for that, meaning that we understand that power is within communities. We understand that systems were not created for us, with us at the center. And we also understand that in order to be liberated and free, we must center those within the furthest proximities to power. So with that being said, one of the things that I wanted to name specifically around our work, and some of the legislative impacts that we're seeing, specifically for Black women, Black, queer, and trans communities and young folks, especially in the South, who are facing the most severe impacts. And when we think about rising morbidity and mortality rates related to pregnancy, birth, barriers to pregnancy and birth, and access to full range, comprehensive, culturally humble sexual and reproductive care, that includes abortion and gender affirming care. So a lot of the work that we do is being loud about gender affirming care, and abortion services are culturally humble, full range, comprehensive sexual and reproductive care. And for folks that may want more information on what that can look like or what that entails, so outside of reproductive care that we're typically speaking of, you're thinking about primary preventative health care, hormone therapy, mental health support, voice training, gender affirming surgeries, fertility preservation, and reproductive care. Especially right now, we launched a campaign, Fertility Justice Now, because we know that IVF and fertility preservation is directly being attacked right now, especially for queer folks, especially for Black women, and especially for trans folks. So that's a bit of the work that we're doing in relation to that. And some of the things that I believe folks can get involved in to defend reproductive justice resources, specifically investing in Black women, queer, transgender, expansive-led reproductive justice organizations, demanding the expansion of abortion access, birth control, gender affirming care, and Medicaid for all. And then finally, building relationships with policymakers and pushing them to resource and trust frontline communities to lead the way for moving forward.
KR, I just want to ask one question. When it comes to mobilizing the youth, I mean, many people on this call may have, a child your age, right? What can they talk to them about to kind of get them in the fight? What do you find works with the young people that you're involved with?
Sorry, y'all, was tending to one of the young people in my life. My youngest, my 2-year-old Leo. Yes, one of the things that we believe work to get folks involved is, and this is actually shown in some of the data that Regina was speaking about in regards to In Our Own Voices, is that yes, abortion care and access to it is very important. And also folks are like starving. Folks are not only like, I'm not just saying starving as far as food scarcity, but I'm saying as far as like our economic stability and safety, our emotional, psychological safety and well-being, how we're just doing the best we can to just navigate every moment as possible. Folks are underpaid, unfairly paid, fearful of just like leaving our doors and being unalived. So, and then the weathering, the perpetuation of hurt, harm, danger, violence, oppression within every system, social dynamic, and interaction that we're faced with. So going into college campuses, high schools, or just out in community and such, we don't lead with, hey, let's talk about access to abortion. I mean, we're very loud and clear about abortion. And also if folks are, for instance, a great deal of our community are sex workers, coming into a conversation with someone who is engaging in sex work, and sometimes for survival and stability and such, you don't really enter the conversation speaking about, let's talk about access to abortion, right? So you meet folks where they're at, and specifically for young folks, they, and I say they because I don't know if I'll be considered young-ish anymore, but many of our community want to experience joy and freedom and just engage in a space that is created for them and feel safe. And so Spark is very specific about Spark being an entry point, a pipeline to not only leadership development, but just safety. Let us, if we may not be everyone's political home, but for those who are searching for a political home where they feel safe and can experience joy, liberation, freedom, centering our rest, not just like not just rested in capitalism, but rested in like just our well-being and sanctitude within us, then Spark is the place. So that's where we lead with when we're out in community doing our grassroots work and such, is just joy and trying to meet folks and address the bare minimum needs that we need in order just to survive.
Thank you. I love what someone just said in the chat. Meet them where they are physically, emotionally, mentally. And that's a lot of times, we try to meet these young people where we are, and that never goes well. Tiffany, I'm gonna throw to you.
That's right. And I appreciate that, Dr. Redmond, because the reality, and I appreciate the point, rested in our well-being. In order to meet the young people where they are, we got to check our judgment first, right? And we have to understand the language that's being used in order to connect. So that becomes a part of our strategy. Dropped several nuggets. Appreciate that. Thank you so much. And so now we'll turn to, when we talk about the movement continuing, we'd like to bring to the stage Representative Latasha D. Mays, who is also a reproductive justice warrior, but also representing District 24 out of the House of Representatives for Pennsylvania. Representative Mays, the floor is yours.
Good evening, everyone. Good afternoon, Black Women's Health Imperative family and community. It is a joy to be with you all tonight. I feel at home. My work and everything everything I do, how I lead and legislate is rooted in reproductive justice. And so thank you for the invitation to be here tonight. And the work for reproductive justice lives on in Pennsylvania. And my journey began as founder and now former president and CEO of New Voices for Reproductive Justice. And that work shaped me in so many ways. And I just said to one of my best friends in this movement that everything I ever needed to be an elected official, everything I ever needed to fuel and motivate me as a legislator, I learned from reproductive justice. And to be very clear, I learned from Black reproductive justice. And so I'm coming back to you all now as a Black woman, as a Black lesbian, as a Black mom, and as a Black woman legislator. And so at this time, more than ever, we need reproductive justice in our legislatures. We need them in our city councils. We need them in executive offices. And I'm pretty sure this is a C3 conversation, but it's gonna take the organizing and the electoral power to place our movement at the center of policies and priority and the powers that be within legislatures like mine in the great Commonwealth of Pennsylvania. And so after being a part of the reproductive justice movement for most of my life, most of my adult life, I can see from the other side as a legislator, who truly holds power, and how we engage, how we can be even more effective during this time in a movement, a reproductive justice movement founded by 12 powerful Black women in 1994 who had the vision so that we would be prepared for a movement that's prepared for a moment such as this. And so what we see at the federal level has been devastating. It has been catastrophic, and it has been clarifying. So if you didn't know that our rights were never fully enshrined as Black people, as Black women, girls, femmes, and gender expansive people, now you know. If you didn't know that your degrees and your socioeconomic status would protect you, now we know. If we didn't know the racism and the patriarchy and the homophobia and transphobia is baked into our society, and it is being played out and lived out in these first 100 days, and not just now, but before now, but we are seeing it in such a crystal clear way. And so our state legislatures are one of the ways that we protect folks in our nation. And in places like Pennsylvania, I want to say that elections matter and they do have consequences in the most C3 way I can say it. But I want you to know that the work that we are doing in the Pennsylvania House of Representatives is because we have a one-person majority based in my community here in Allegheny County in the city of Pittsburgh. That could change. And you know what? Bills that are attacking trans and gender nonconforming and LGBTQ plus folks, abortion bans, continued attacks on healthcare, our environment, and all the violations of human rights that we all are fighting against, they would be going down, but for a one-person Democratic majority led by the Speaker of the House, the first Black woman to have that role, the first woman to have that role, Speaker Joanna McClinton, and me and my co-chairs, Rep. Cephas and Curry, who created the Pennsylvania Black Maternal Health Caucus because of that one-person majority that is allowing us to invest in Black maternal health in a major way to the tune of $23 million for the first time in our state budget because we created a Pennsylvania Black Maternal Health Caucus, for us to introduce our Pennsylvania Momnibus based on the congressional work that's happening with our great leadership in the federal caucus. We've been able to move 8 bills, 5 out of the House, 2 became law in a 6-month period last year. And we're continuing the Pennsylvania Momnibus with a literal bus as well that we just introduced in the Pittsburgh Regional Transit System to educate our communities about the fact that Black women, Black mamas, and birthing people are 2 times more likely to die before, during, and after childbirth up to the first year in Pennsylvania than white moms and birthing people. But that we are committed to ensuring that we end the 93.5% of preventable maternal deaths in our Commonwealth, and that we have to understand that what happens at the federal level is deeply impactful at the state level, because there's no amount of dollars that the state has to replace the loss of billions of dollars of Medicaid funding, especially when it comes to maternal health. So I'll stop there.
Thank
Just
you.
because I know we have such a great other folks to listen to. I have to shout out Billy Avery. Thank you for your leadership. Thank you for the sacrifice. Thank you for the inspiration, because I would not be here in this role or the opportunity to do what I've done for over the last 25 years. And of course, shout out to Linda Goler-Blunt for her friendship and leadership over the years. Thank you all so much. Thanks for having me.
Thank you, Representative Mays. Oh my goodness. I want to shout out some folks have been coming into the chat. So I just wanted to make sure we've got Renee here checking in from AME in Health, All Men Equal in Health. And I know we're going to get into that in a minute, but we've got to have everybody in this conversation. This is not just a Black women's conversation. This is a gender expansive conversation. This is our men folk. This is all of the people. So I definitely am happy to see that in the chat right there. But Tiffany, I know you've got some things cooking.
Absolutely. And I definitely want to give some additional shout outs to some folks that are in the room, specifically our Texas State Officer, Constance Jones, who has dropped some critical information regarding the reproductive movement in Texas. So if you are chiming in from Texas or proximate to that state, or just want to support what's happening in that state, that information, scroll up in the chat, screenshot it, capture it, and make some connections. I also want to call out, there's several folks from Pennsylvania in the chat that are like, hey, can we connect afterwards? Being in this room is to create that safe space for connections to be made. So go ahead, slide into those DMs and connect with each other, get that information so that this work can continue after today's call. What we'd like to do now is transition to Dr. Epps, who is the Senior Director for Reproductive Justice, who is going to level set with us some information that we need to put into our toolkit to keep the movement going. Dr. Epps, the floor is yours.
Thank you, and good evening, everyone. I am so excited to be with you in this moment. This is truly powerful. I know we're all in our Zoom squares, but it just means so much because I've, spent my time traveling over the last couple of months to different college campuses and just being in the room with so many young people who are eager for this information. And I just want to thank everyone that went before me, and I've seen them in their work and have been able to work closely with them just through being with the Black Women's Health Imperative. And I just want to say during this time is crucial for intergenerational movement. I am someone who's been with the Black Women's Health Imperative starting out as a young person in undergrad and have worked my way up. Definitely shout out to Billy and also Linda who have seen me grow up, right? Through this organization, and which was truly my introduction to the reproductive justice movement. And during this time, I think in my role throughout my Sister's Keeper program and all the reproductive justice work that we do, it's important to bring other young people into this space. I remember when I first got the introduction, the education that came around and the opportunities that were provided to me to be able to hone into my leadership skills, to be able to see the connections is how I was able to do so well with the public health background and to be able to show young people who are on college campuses. We place special emphasis on HBCUs, but we love an educated person, okay? And I think it's just so important at this time to just show people what tools and resources that they need to self-determine their lives and to see how they fit in the movement. You don't have to come into the movement in a specific way. You can come with just the yearning for knowledge, to be engaged, to be in community, and to be in support. We spent over the last couple of months going to different college campuses because we know, given the current state of sexual and reproductive health right now and rights, that young people need access to contraception. We see what's happening with the cuts and how that will deeply impact them and being able to make the choices that they need, to be able to control their futures, right? To say what they want to do with their lives. And we have been going around talking to them, creating spaces, talking about self-advocacy because they need to be able to talk about those issues that deeply impact them on the daily level. And then for them to translate that into powerful storytelling when we go and to meet with legislators and tell them this is how it deeply impacts us and what we need from you, what health promoting policies we need from you that will not only defend where we are, but also protect us in the future. So I think that's so important and something that I want to give a shout out about. We have been leveling the court for the last several months through our partnership with the WNBA and Opill. Opill is the first daily over-the-counter birth control pill that is putting this pill into the hands of folks that need it, right? Because we understand you don't need a prescription for it. You can get it from your local pharmacy. They better not ask you for your ID because that's not required. You have the right to access that. And I think it's so important during this time for folks. And I just want to make a huge announcement because one thing about the Black Women's Health Imperative and just what I've done in my role, education is amazing. We need it because we can't assume that everyone is operating from the same knowledge that we all may have, but providing tangible resources is much more important. And so we have launched the BWHI Opil Access Fund, which is providing young people with 3 months supply of Opil. And that is huge considering how copays and just some of the life disruptions and other financial barriers that folks may be impacted by. We want them to know that we are here to provide that for you. So if you know somebody who needs this, please, they're dropping the links in the chat right now. We want to make sure that we're putting it into the hands of people that need it the most while also uplifting their daily challenges in our work. So I'm just so excited to be here to continue the work with the Black Women's Health Imperative. I'm so inspired by everyone that's here, those that we've already heard from and those that will soon follow behind me. I'm just so appreciative to be able to do this work. Thank you.
I want to double click on what you were just saying. Those resources mean so much, Dr. Epps. They really, really do. And we've been seeing around the country these young people light up. We know that we've been going from different states that have restrictive laws on the books. We've heard from administrations at universities and colleges that said, hey, we want you to come, but you can't say this. We want you to be there, but we can't use the word reproductive health. Maybe we can just say women's health. I mean, this is what we are up against. But let me tell you this, we haven't backed down. We know where where we're going, and we will continue this work no matter what those parameters are that are put on us. These partnerships are wonderful. And so we're able to do some amazing work through them. And I want to double click on that because we also have a wonderful partnership with our friends from Procter and Gamble. We've given out over 100,000 tampons across this country. We have made an entire documentary called Me Period about menstrual equity, puberty, menstruation. Please put that in the chat because that film is something you can watch with your loved ones, with your young ones, with your husband, your partner. You can watch it with the whole family. We got Tabitha Brown in it with her daughter. We got Cheryl Lee Ralph and her daughter in it. And we've got real world, everyday mothers and daughters in that film, ready for you to watch today, tonight, tomorrow. You'll be tired after this call. But on all seriousness, menstrual equity, reproductive justice, all of these areas, we are working day in and day out for you, and creating tools and resources that you can share. So we didn't just make a film, we made a discussion guide, we made a caregiver's guide, we made all of the different things. We linked to different books that you can buy. We did everything we possibly could so that you can arm yourself, because what we know now is that they are trying to take away our right to be able to talk about menstruation with young people in schools. They're saying, oh, well, we're not going to discuss it till the sixth grade, when we know that our young people are getting their periods before the sixth grade. So we're going to arm you with the resources. And I think if anything has been taught in this past 100 days, Tiffany, right, is that we've got to arm ourselves with all of these wonderful resources.
That's
Okay.
absolutely
I'm
correct.
going to give it back. I'm going to give the floor back to you. I'm
Listen, no,
rambling.
stay on the floor. That's why you're my partner in power on tonight, because here's the reality. It is time out for eating what we've been fed and time for us to feed ourselves. And that's exactly what the Black Women's Health Imperative is doing. And that's what we're doing on tonight. And so as we've talked about reproductive justice, let's dig in a little bit more specifically around maternal health and what Black maternal health requires in this post 100-day context. So I'd like to bring up Angela Aina, co-founder of Black Mamas Matter Alliance. The floor is yours.
Hi, good evening, and thank you so much to the Black Women's Health Imperative. My name is Angela Doinsala Aina, co-founder and executive director of Black Mamas Matter Alliance, or simply BMMA. In this spirit of recognizing just the presence of all of our generations here, I too just need to take a moment to thank from the bottom of my heart, and just give so much love and honor to Billie Avery. Every time for years, and I know Billie Avery, every time I see her in person, over the years, I'll just randomly say, hey, hey, Billie, thank you for everything, because we are truly standing on her shoulders and how we organize and the work that we do. I also need to uplift and thank also Dazon Dixon Diallo, who is my master teacher, who taught me reproductive justice and and really rooted me in Black women's health. Even and as I was getting my training at Morehouse School of Medicine's Master of Public Health program. So just wanting to uplift that and thank them, because that is really the essence and the reasons why we were here, and how we that are spearheading this movement on Black maternal health, how we were birthed, right? We were birthed out of a collaboration between Center for Reproductive Rights and, of course, Sister Song. And also shout out to Monica Simpson, my founding board member as well. BMMA is a national network of Black-led and Black women-led organizations and multidisciplinary professionals. And we do this work deeply rooted in the birth and reproductive justice and human rights framework to ensure that all Black mamas have the rights, resources, and respect to thrive before, during, and after pregnancy. We also serve as the premier Black maternal health professional organization where we focus on building, in particular, the skills, convening, and mobilizing the global Black perinatal, maternal, and reproductive health workforce to end, and we believe this, to end maternal mortality. Right. And we honor a lot of our organizations that far existed before us. That's why we always uplift all of our partners in our alliance. We have so many wonderful partners that are on this call, including Black Women's Health Imperative, that is just represented across the nation and soon growing across the ponds, because we really want to interact with our comrades across the Black diaspora. I should also mention that here at BMMA, we utilize the term Black mamas to intentionally include a range of people, that cis women, trans folks, gender nonconforming and expansive individuals with and without the capacity for pregnancy who are of African descent across the diaspora, to those that care for and mother our families and our communities, whether they have given birth or not. This is why we stand firm in solidarity with Black mamas. And this is our foray of how, when we entered into this space to advocate and push back and showcase the solutions of how we can address this very unfortunate and ridiculous inequity with what we're experiencing around maternal mortality, especially its pervasiveness in the United States of America. This is why we are centering ourselves, our solutions, and what comes out of our maternity care practices for centuries, right? In this current context, when maternal health becomes this partisan talking point, we lose focus on the lives and dignity of Black women and birthing people. It becomes easier for elected officials to stall legislation, underfund community rooted solutions, and ignore the actual structural racism and gendered oppression that shapes our healthcare systems. This political posturing has real devastating consequences in the United States. Black women, it's unfortunate that this maternal mortality rate in this country is so pervasive. The latest research that comes out of CDC as of 2023 showcases that, interestingly enough, the maternal mortality rate has slightly decreased for everybody else but Black women. Not only that, our rate slightly increased. And, again, that further showcases what we've been yelling from the get-go. These are systemic racist issues. And it requires a shift, a change, and even in some cases, a complete destruction and rebuilding of our healthcare system. It is not because there's something innately wrong with Blackness or Black women. As a matter of fact, we know that we wouldn't even have this concept of obstetric practice and gynecology without, the use, unfortunately, and the experimentation on Black women's bodies, and alongside that, the exploitation of our cultural midwifery and baby catching work. And so therefore, politicizing in this current context maternal health and maternal health solutions, and even going as far as stripping away some of these funding and protections that we know is essential to address systematically a lot of these issues and challenges that further convolutes and makes these maternal mortality rates that much more pervasive. To strip away these protections is an all right assault, honestly. It is inhumane. And so, here at BMA, we have worked very hard over the last several years to produce a very comprehensive policy agenda. It's called Black Mamas Matter in practice and in policy. And we've comprehensively outlined all of these different areas, including wanting more resources, more funding, more attention and efforts to further expand Black healthcare providers, in particular, our Black midwives, ensuring that policies, not just at the federal level, but also in particular at the state level, are expansive enough that allows for all midwives of all types, including our direct entry midwives and our granny midwives, are able to practice at the fullest scope of their skill set and even of their licensure if they choose to have that. We also know that we need more policies, especially at the state level, that recognizes and respects community-based doulas and doula services, especially coming out of Black-led initiatives, and ensuring that the historical policies that have impacted and reduced the amount of midwives in our communities, ensuring that that doesn't now happen with doulas, right? And so, and we're already seeing that weird nastiness again happening across states, even with a lot of these so-called doula legislation that on the front end may look like it's a step towards the right direction, but you know, when we start to peel down the pieces, it has components of it that's set up to be more restrictive. And we're saying, no, we need to slow that down and we need to center the actual Black doulas and the Black doula organizations and trainers that can speak best to speak to these more comprehensive and supportive state level policies. Also, we need to, especially for those of us that are in the South, BMA is rooted and headquartered in Atlanta, Georgia, and so we have a very strong focus on the South, and with that, understanding that there's so many what is considered maternity care deserts. So that means that with all of these hospitals closing, hospitals shutting down their labor and delivery services, that means that we need more supportive policies and resources to expand birth centers, especially here in the state of Georgia. You know, so these are the type of things and these are the type of solutions that we need to continue to focus on and not get caught up in the politicization of so-called DEI and wokeness. We need diversity, we need equity, we need inclusion. It is essential and important to addressing these issues. And just one more thing to say, while we know that these statistics and this data around maternal mortality and morbidity and the fact that it disproportionately impacts Black women, it's so important to us here at BMA to really uplift and center that we always have the solutions. Building community is the solution. Support your local Black maternal health, birth, and reproductive justice organization. They exist, they are there, they're doing great work. And so you can learn more about some of those organizations by visiting blackmamasmatter.org and looking up all the profiles of our partners. But again, I want to further emphasize that this is not the time to back down. This is the time to step up, build community, understand that our community-based organizations are an economic good for our Black communities, and we need to support them. We need to invest in them. And so, yes, it is not time to revel in doom and gloom. Thank you.
Thank you so much, Angela. And, you know, it's making me think, I want you all to share with your networks. You know, I hear a lot of people say things like, you know, I'm going to start a nonprofit. And I don't want to totally, you know, discourage people from starting one, but there are so many to support within the work that you want to do. And so we find that in breast cancer, we find that in maternal health, we find that in so many different areas. And so please, let's support the orgs that already exist. And we don't all have to become founders, because I'm telling you, Billy can tell you, and Angela, you can tell him, it's some serious work.
Yes,
Thank
it is. Yes, it is. Thank you.
Tiffany, who we got?
We've got lots going on, and I want to make sure folks don't miss out on all of the connections that are happening in the chat. There have been several quotes that you can repost, retweet, and make sure you add BWHI. But now we want to continue the conversation in maternal health. I may ask Angela for you to take a look at the question in the Q&A, and then we can bring voice to that real time once you have an opportunity to answer. But Dr. Thompson, who is an OBGYN and vice chair of the BWHI board, we'd like to bring you to the stage so you can share a little bit about your clinical view and what our patients are facing amidst all that is happening in the climate around reproductive justice. Dr. Thompson, the floor is yours.
Okay, I can't control my camera. I'm assuming someone will turn it on, but I want to say thank you for inviting me. Let's see. There we go. There I am. I put myself in my happy place, a library. I love books and reading. And I am Dr. Sharon Thompson. I am an OBGYN. I've been practicing medicine for about 20 years in Phoenix, Arizona. Fun times here. And I have a degree in public health and have been doing public health work in addition to my work as an OBGYN. And I'm proud and happy to be on the board of Black Women's Health Imperative for the last several years now. So I want to follow Angela. I'm so happy to follow her because a lot of the things that I would say, she sort of started, and I'll try to continue them. And what I want to focus folks on right now in this moment that we're in is we have to understand the assignment, right? We have to understand it. So I teach students, I teach all kinds of students, medical students, physician assistants, nurse practitioners. And one of the things I tell them, and most of them are not Black or brown, right? Most of them are going to be white folks, like representing the country. And I tell them there are 4 themes that underlie everything that you see in medicine today and everything that looks crazy. And those themes are racism, sexism, capitalism, and sort of 4 is like a 3B, our work culture. And I'll focus on the top 2 of those today. Maybe the third one will come up. It was only in 2014 that the NIH passed the policy, the National Institutes of Health passed the policy that said, if you are going to study cells, if you're a researcher, we're giving you money and you're going to study cells, you have to include female cells. 2014, y'all, 2014. So I say that to say that we have just begun to address women and women's bodies and how they work and what will help us have optimal health. And now we're facing this administration that wants to roll all that back. So we have to understand that rolling back DEI, I don't know who's in the audience for this call. Many of you are probably Black and brown. Some of you are probably white. I want you to understand that rolling back DEI, diversity, equity, and inclusion programs, making a list of words that can't be said in order to get federal dollars, including the word woman is on that list, is deadly to women. It will transform in not a good way what we know about women's bodies. And remember, we had a long, long way to go. It will impact what we learn about maternal mortality and how to prevent it. It will impair our ability to understand conditions like endometriosis and fibroids and other conditions that affect primarily women. So the assignment is actually it has grave consequences if we miss it. And so even in this moment where I think Lisa said earlier, some of these institutions, and I think someone else talked about funders, are getting scared. They're pulling back as if their commitment to these issues was just a checklist and not about principles. But I'm here as a physician to tell you, these are not just checklists. These are not special interests. These issues fundamentally affect what we know about how disease happens, what we know about treatments that are going to be effective, what we know about how to evaluate certain symptoms. Because the hundreds of years of research and medicine that we've done so far focused on white men. White men will tell you that. That is not partisan. That is not bias. That is just fact. And so now we need to, moving forward, focus on learning about women, learning the fundamentals. I'm sure all of you have seen the specials about menopause, Holly Berry and Oprah Winfrey, talking about the lack of diagnosis and treatment for menopause. Well, that's because we had a history in this country of research on white men. They don't go through menopause. And so we have to understand that to allow this administration to continue to roll back on what they term DEI and what they term special interest is not a special interest for any woman, whether she is Black, brown, white, blue, green, purple, or alien. Rolling back these policies is deadly to us. Maternal mortality rates in this country, like Angela said, are outrageous. They're nothing short of outrageous. For a country as rich as we are, we should be sitting pretty and living like Singapore, where their maternal mortality rates are like 3 in 100,000. In the United States, it's up to 138 for 100,000. Women who are childbearing age will die as a result of pregnancy. That is outrageous on anybody's scale. So I don't want to scare you, but I do want to light a fire underneath you. DI is not just about Black and brown people. DI is absolutely about more than half the population, more than half the electorate. Women make up about 51 to 53% of the electorate. However, women is on the list of words you can't say. That's offensive. And we all should be offended and energized and activated to go out and be active, not just sit in our living rooms and be scared and passive. Someone said, this is a time for courage. This is not the time for reticence. So what can you do? Because I'm all about doing. Complain more. Women suffer in silence way too much. And that's one of the reasons why our issues have been on the back burner for too long, because we're busy running the household and doing our jobs and raising the kids and keeping our husbands happy. And we don't complain about the things that are hurting us or making us fatigued or tired. So number one, complain more. Stop suffering in silence.
Yes.
Number two, speak up to your elected officials, to your everywhere, your school board. What's in the library? Why y'all taking books away? We need to learn real history. To your local legislators, make sure they know who you are. Get them sick of you because you call so much and you email so much. So speak up. Act locally. Angela said this, and Lisa said too. There are organizations in your local community that is working to make your healthcare and your life better. Look for those and support them. Understand the assignment and elect women. So I'll close with this. Medicine in this country has a terrible reputation of being available, accessible, and responsive to everybody. But I will tell you, over the last 30, 40 years, when we started to let women be doctors in big numbers, because make no mistake, this wasn't always so. When we started letting Black and brown people into medical schools, and this only started in the 60s, we have started, you can palpably see the difference in the transformation of healthcare. And when I say women in medicine, I also mean in public health in terms of advocacy. Mammogram screening, that was not a thing, y'all. Don't take it for granted. Women had to fight hard tooth and nail for that, right? Obstetric care, the things that men thought that if they cut a woman when she was having a baby, she would heal better. Absurd ideas. Only men would think that because they're not women. So elect women, make sure that women you are seeing women in your community in positions of power, because women bring a different perspective. When women came into medicine, medicine started changing. We don't pat women on the knee now and say, they're their little lady, which used to happen. So remember that it is not just a special interest to have women in positions of power, whether they be elected officials or running corporations or hospital systems. It makes a difference. It makes a transformational difference in who we listen to, who we think about when we're planning, how we develop therapeutics, and who we do research on, the questions we ask, and the answers we get. So, my message today, understand the assignment. This is not a special interest. It's not just about Black women as much as I love Black women. It is about everybody. Don't be bamboozled into letting someone make you feel that when we say diversity, it's not about you. It is absolutely about you. And I want you to be active and engaged and involved in making sure that you speak up for the things you care about. So happy we're here today, and I can't wait to hear everyone else.
Thank you, Dr. Sharon. I'm going to jump in real quick here, Tiffany, because you mentioned research a couple of times, and I know we're going to bring up a researcher, but I just put in the chat a couple of times, if you are over 30 and you have not taken our perimenopause and menopause survey, this is what Dr. Sharon is talking about. They don't have any data. They don't have any data on us.
Do not.
We were included in a very large, very comprehensive, wonderful study some years ago. We were included, but I don't even have the numbers on that. As of today, I believe we already have the largest study for Black women about perimenopause and menopause. I want the numbers through the roof. I want the numbers through the roof. I want to be able to say we had 10,000 people, and we all right now can send this survey to 3 people in the girlfriend group chat, and we can get those numbers tonight. So I put it in the chat. It's super easy. It takes 15 minutes, and it's a comprehensive survey. So I just wanted to throw that in there, Tiffany. Keep going.
Absolutely, because research matters. And what I want you to do is copy that link, go ahead and paste it in your other group chat. And after you do that, drop 100 in the chat. I need to see about 50, 11 100s to let us know that that link has been dropped in the chat. So speaking of research, we have the Director of Research and Community Engagement, United States of Care, Dr. Haynes. The floor is yours. We look forward to hearing from you.
Thank you all so much for this amazing opportunity to be in this space full of powerful, trailblazing women that have the knowledge, the skills, the talents, the abilities to get things done. And that's what it is going to take in this climate. It is an honor to be in the room with all of you all tonight. I am going to talk about data and research and the threat to it under this current climate. So a wise researcher once said, we can't fix what we don't measure. So I want to say, do I need to say it again? I will say
it again.
You cannot fix what you don't measure. I'll lean in on that one. Dr. Thompson, I think, took half of my talking points, but I believe in repetition, so maybe it can sink in. Listen, when data is censored, public health and researchers have less access. And we're talking about health disparities, which we were already plagued by, right? And so I think this is when we talked about this as an act of control. Censorship is an erasure tactic, right? So as you all know, or if you don't know, a lot of data is being pulled down from federal websites, CDC, HRSA, FDA, NIH. The defunding of research programs at institutions across this country means the data goes away, right? And so with no data means that there is no accountability to the health disparities that are out there. Why is it, do you figure, that to Dr. Thompson's point, the erasure of women and the erasure of funding for research for women, right? They don't have to be accountable to it. It alleviates the pressure on policymakers and healthcare providers to take action because you can't see. So essentially, when you take all of these data points around our health and our healthcare down, we're essentially flying blind. So how do you identify a problem? How do you track and monitor where we are? As my dear sister Angela mentioned, you know, the current state of maternal health in this country is deplorable. And we have had, you know, institutions at the CDC, like the PRAMS data, they shuttered that office, right? They hampered and tamped down the collection of those and so many others that have allowed monitor and tracking. Granted, it was not in the direction that we wanted to go in, but we still had access and insights to see what the problems were so we could design interventions. What happens when that goes away? How do you know what to fix, right? And so what we don't know now is the full extent of the disparities that we're working on. And what's kind of worse, not to scare you all, but we don't know what's coming up, right? How are we going to monitor new diseases that are on the rise? How are we going to monitor? I mean, we kind of saw this with COVID, right? If you're flying blind already, how are we able to track things that are impacting our communities more directly, right? And so, do you see where I'm going with this trend of erasure and intentionality on that? And so, just imagine health disparities being exacerbated, inequities being exacerbated, and thereby you can't get to the root causes of what the problems are. And what are we talking about root causes? A lot of the social drivers of health, our economic impacts, the healthcare utilization, the quality and access to it, and so many other complex factors that actually have a direct impact on health. If we can't see it, we don't know what's happening. Okay, so how does this impact us a little bit more specifically, policy development? Currently, we operate in a system, and my role at United States of Care is nonpartisan, so I will try to keep my C3 hat on as well. But we work to center people first, and that's part of what I do. We go around the country and talk to people about their pain points and experiences with the healthcare system, and we feed that data and information up to our state and federal policy teams to work on, create, and develop policies on what we have heard people say, a bottom-up approach instead of top-down. And so data helps with that. It helps to inform policy, but without it and censorship of it, it can lead to I have said the erasure of it, but hey, we actually don't have to deal with it at all, right? We can put our time, energy, attention, and resources somewhere else. Speaking of resources, how are resources going to be allocated to our communities if the data is not there, if the public health agencies and the data infrastructures that have previously been in place are dismantled and not get those resources allocated, right? And then finally, the researchers that don't have access to that comprehensive data and can continue to study these impacts over time. Censored data obviously hinders research progress. And so we end up taking a few steps back. So when marginalized communities are directly impacted, by this, we know we're losing critical knowledge in this space. We know exacerbation of health inequities increase, and it on its face reduces the advocacy power, if you will, and thereby erodes trust. But I feel like now is a time where we can answer the call. As Dr. Thompson said, I told you she took half my talking points. We have to understand the assignment. I am sure that with folks on this call and folks that you know and folks that you are connected with in your network, we are going to have to shift the power to what we have been doing to what we need to do that works best for us and our communities. What does that look like? My public health training has always been, and I pray will always continue to be, community-based participatory research. For those that you know about it, it is not new. It has been around for ages, but we need to take it back and reimagine that, right? That means centering the voices of marginalized communities, recentering what their needs are at every stage of the research process. If you heard the term, nothing for us without us, let's bring that back. It empowers communities to take action, to actually advocate for themselves, because they're the ones in the communities who know the problems best. The solutions are always in the communities. It creates shared ownership, right? So how can we redirect some of the institutions have had the power for data collection and monitoring. How can we redirect and empower community organizations and nonprofits to do that work and stand in the gap for those that have been defunded? Again, as Angela said, redirect the funds, right? Pour into the organizations that have already been doing this work. How can we build the capacity of these organizations to take this on? And I would argue would be even more meaningful, right? Because there's data sovereignty, there's more control in the communities, there's more governance when communities are in the process and have more of a say, more ethical practices and how data is collected, returned, and is accountable, right? That bidirectional accountability. And so the control is really with us and our communities, and we just have to create and reimagine the infrastructure that actually puts us back at the local community level to get things done. So the last points I'll make related to that, again, advocate for policy change. And when I say that, it has to be at the local level. We have to think about what is happening in our backyards. And the accountability will start in our backyards, literally, with what people are doing. Ask them, well, what are you doing about collecting data? What are our state departments doing? Demand accountability. Push for increased funding for research that prioritizes communities. Support community-led organizations, ask questions, right? Because they're counting on us to not be paying attention to this. So when you ask the questions of them and keep asking and go deeper and hold their feet to the fire, they have to do something about it. So I will stop there because I can easily get on a soapbox about this for sure. But again, it's been a pleasure to be here in this part of this really important conversation.
Thank you. And, I just want to say you didn't specifically mention clinical trials, but, we strongly believe in participation in clinical trials. And you'll hear people talk about, Henrietta Lacks and Tuskegee and all of these things. But we've got to understand that in order for us to move the needle, I remember the day when my sister, who is a research pharmacologist, told me that I needed to take my mother off lisinopril. My sister told me that. And she told me because she knew that lisinopril didn't work that great for us. So I go back to the doctor and I say, hey, doc, my sister said this. And then the doc said, oh, yeah, that, we can switch her out. What?
Can I put another plug in related to that point? For folks that know, American Cancer Society has an amazing nationwide program. It's called Voices of Black Women. It's for looking at breast cancer. And we know what the breast cancer rates in our communities are. Even though we are not diagnosed, we die earlier than our white counterparts. It's called voices.cancer.org. If I wasn't talking, I put it in the chat.
Yep,
I'll say it again, voices.cancer.org. It is led by a Black female epidemiologist out of Emory University. And it is essentially a clinical trial, but it is monitoring data for Black women only. That is a place that we can plug in and support. And it is, again, huge. If you're not a data person, you can plug in on these clinical trials that are more focused, the ones that are still funded, mind you, that are still focused on Black folks, so we can have more control over our health.
Thank you, Dr. Haynes. Yes.
Thank you, Dr. Haynes. That was awesome. Nothing for us without us, and you can't fix what you don't measure. And so we appreciate those nuggets and that call to action. And all of this is under the umbrella of 3 words that have been weaponized like no other: diversity, equity, and inclusion. And we have author and strategist to take us through what we can do with systems accountability and so on. Amber Cabral, the floor is yours. Welcome.
Thank you. Thank you for having me, Lisa and Tiffany and Black Women's Health Imperative. I'm actually like vibrating because it's like this conversation is so good. And there's so many nuggets and so many things to take away. And much like, the 2 doctors before me, many of my talking points have been stated up to this point, but there are some things that I absolutely want to make sure that I cover that I didn't necessarily hear driven home. I've spent 20 years working in DEI spaces in corporate, And so I am very well acquainted with the weaponization of the language, with the changes that are happening in our workspaces, with the changes that are happening in our schools, with the changes that we are navigating as a result of those in our personal spaces. And so, you know, while there have been many points shared about that language and those changes happening, the thing I want to make sure that we always remember is that we define us. It's up to us. We define us. We have command of us. We know who we are. Okay. And so it's critically important that we continue to keep that in mind so that we can retain and control our own narrative, even in the midst of the language changing, because we don't always get a say about that, but we do get a say about us. And to me, that's what this entire conversation that I'm hearing tonight is about, is remembering the power of carrying our own narrative. And so while the words are evolving in lots of ways and that don't make sense, and they're trying to take terms and turn them against us and use just regular words that we've been using forever. But let's just be very honest. Words have been evolving since the beginning of time. And Black women have been agile and resilient for just as long. And so we are the culture carriers, we are the core communicators, and I want us to be willing to continue to exercise that power. So I know that's not necessarily the DEI message, but it is when you consider the power of the narrative that we need to share. I also wanted to just kind of highlight that equity happens because people do it. One of the things I have to remind a lot of the corporations that I go and work for is that you can't sit back and wait for permission. We're not gonna get permission for everything. And they're not gonna be able to make a rule about it until it happens. So do the work. No one's standing over your shoulder trying to make sure that you are actually hiring equitably. No one is actually checking to make sure that you are being considerate about fairness in every step that you take. You get to put it in your life the way that you want to. And the thing about doing that is it gives us an opportunity to bring it to life as a whole. It's not just for women. It is not just for people of color. It is for all of us. And if we make an intentional effort to make sure that we are bringing life to equity in every step, what will happen is that we will move forward regardless of the language that they try to manipulate, regardless of their attempt to try to make it scary, regardless of the way they try to manipulate what it is that we know we are actually trying to say. So a couple things about the boycotts. I didn't hear those necessarily come up, but I wanted to just touch on those for just a moment. In order for us to push back, in order for us to boycott, in order for us to resist, we need to be well. I see lots and lots of people trying to push. I heard today in this conversation how much we need to stand up and where we need to be and how we need to commune. But I want to make sure that while you are showing up in spaces and carrying equity forward, that you remember to get enough sleep, that you make sure to move your body, that you make sure that you are leaning into community and also healthy relationships. Make sure you are making time to play. Make sure that you are giving some of the skills that you naturally just enjoy, that you are giving those to others just for free because it gives you happiness. I think we often get caught up in the fight and in the resistance, and we are energized by that. And I am so grateful to be attached to a community that does that. Like, I'm literally vibrating just from the conversations that are happening. But we also have to take care of ourselves. This is serious work, but it can't come to life without joy. So where are you getting your joy? We can't get to equity if we are not here. So part of seeing Black women's health as imperative to me means that we must also prioritize our well-being. So that was my message for today.
Thank
And a
you.
powerful message it is. Where are you getting your joy? So you heard the call. Amber told us, get those fans, get in that line dance, get you some joy in community. Learn that Luther bad boy dance. Some of y'all still need to learn the Tamia. Okay. Take a nap and rest. Equity happens because people do the work, but you first have to be well. Amber, powerful nuggets. We appreciate what you've shared and all that you do in this area of not just diversity, equity, and inclusion, but humaning well.
Yes, humaning well. That is a phrase that I know you are doubling down on, Amber, and she has a podcast as well called Humaning Well. I encourage you all to check it out because she's just always going to make you feel so good when you listen to her. So yeah,
I'll drop the link in the chat. Y'all
thank you. Okay, who we got next, Tiffany?
Listen.
Oh, wait a minute. I heard a rumor that we are going to actually have some men enter the chat.
You know what? It just hit my line that is exactly happening, because we said very early on, yes, it's the Black Women's Health Imperative, but this work is done in partnership and collaboration across all types of identities and identity expression. So with that, we want to bring?
Yeah, let's do it.
Let's go ahead. Khalil Gibran Muhammad, Professor of African American Studies and Public Affairs out of Princeton University. My brother, the floor is yours. Welcome.
Thanks so much. And I'm breaking glass ceilings here, so really excited. And I just need more Black women's health in my life because of what you all, the community that you are building, the work that you are doing. The imperative is incredible, and I'm grateful for being able to be in community tonight. So I wanted to talk a little bit about the relationship between economics and health, between the long-standing exploitation and oppression of Black people. After all, the whole point of us being here was not to hate us. The whole point was to build wealth on our backs. And Black women not only bore the burdens of slavery, the burdens of medical experimentation, but their very wombs were sites of wealth creation in this nation. And so it is impossible to take stock of where we are in this moment of extreme danger directed towards our community without recognizing the deep roots of the problems we face. The executive orders, for example, we know have not only given extreme license to decimate the federal workforce. In fact, it is estimated that roughly 20% of the federal workforce are Black people. And that can go as high as about a third, depending on what agency, like the post office. Now, we've long known for about 75 years that the greatest economic advances in this country came during the Great Migration, particularly after the 1940s. And a huge push for our economic advancement was directly related to Black women moving into civil service work. You might have even seen the film that Kerry Washington produced about Black women serving in World War II itself. So the fact that the federal government has fired tens of thousands of workers means that we are disproportionately, and Black women in particular, are bearing the costs and burdens of that federal purge. It is also the case that across the spectrum of research that the National Institutes of Health has been sponsoring, so much of what came out of the racial reckoning of 2020 focused on sickle cell interventions, for example, began to draw attention to maternal health care, much of what we've talked about tonight. And so I want to just acknowledge that many of those executive orders that have led to not just the purging of the federal workforce, but also the cancellation of federal grants and contracts from higher education to the CDC to across the nonprofit landscape will also have a disproportionate impact on research that can and will one day save Black women's lives. We just heard from Amber talking about DEI, and I just want to acknowledge here that the most powerful Black woman in America was a victim of a public lynching as the president of Harvard University, Claudine Gay, when she was pushed out under the attacks of the Republican Party before Trump, but also under the guise that as a DEI hire, she was unqualified. Now, many of us know, because our friends and colleagues work in this space, that Black women are also overrepresented in the work of DEI, whether they carry the title of Chief Diversity Officer, whether they work in HR. Many of us know it's just a fact that in corporate America, Black women are overrepresented in HR roles. And over the last 20 years, and particularly over the last 5 years, have played a huge part in doing a lot of that equity work. So whether it's the public sector, the private sector, or the nonprofit sector, and including in higher education, Black women are paying a disproportionate costs of what has happened in this administration. Also want to note that a lot of those executive orders eliminated or revoked Biden-era attempts to finally address systemically of what he called a whole of government approach I've written an essay that'll come out in about a year. This is how it works in academia for all of you academics that know this. But I've essentially called Joe Biden the first equity president. With the support of cabinet and sub-cabinet level positions, many of which were held by women of color and Black women in particular, really did try to turn the weight of the federal government to finally address systemically the ways in which this country has consistently exploited Black women and Black people's labor. Because the executive orders have eliminated all of that, we are seeing the decimation of various pipeline programs for women in STEM, for example, partnerships with HBCUs, the kinds of programs that would have made a difference long term in representation in various lines of work that women in general and Black women in particular have long been underrepresented. Now, I was asked to talk a little bit about the student loan forgiveness, but I'll just note that it was not the Trump era administration, but it was the Supreme Court in the Biden versus Nebraska case that struck down the plan to address through loan forgiveness the additional burden that Black students, and because Black women are overrepresented in the college age and college going population, the fact that the attempt to address the racial wealth gap and by extension the health of the Black community it could come by way of loan forgiveness, since Black people are much more likely to borrow to attend college since they don't have the same home ownership or family equity to draw upon. So that's how the executive order landscape is affecting us right now. Let me just note that when we acknowledge the relationship of health to the racial wealth gap, the numbers are striking and startling. For example, the Black-white wealth inequality gap has essentially been the same for the last 50 years. It has not changed much. And for Black women in particular, Black women make about 73 cents on every dollar that a white man makes, which is less than the 79 cents that on the dollar that every Black man makes as compared to white men. Black women compared to white men earn about $49,000 less annually. And one of the things, just to correct with respect to general knowledge about this, for a long time, public policy has focused on human capital development. That is through education, through mentorship, through financial literacy. The basic idea has been if you teach Black people how to become professionals, to aspire to college and postgraduate or post-college training, then that will do the work in and of itself. But the truth is that when we talk about wealth, it is the consequence of policies that favor generational wealth transfers to white people. And it is those generational wealth transfers that have often been home ownership that are the greatest buffer to health disasters and health calamity that lead people not to a primary health provider to take care of their needs, but in fact to an emergency room because they are afraid of taking care of things in advance of the crisis that they face. That can also lead to bankruptcy. And just to put some clarity on this, when we look at the highest level of income ownership, the highest level of wealth, we see the greatest disparity between Blacks and whites. For example, total wealth between those who hold master's, professionals, and doctoral degrees for Black people is $140,000 as of 2022, as compared to white wealth of $944,000. It is remarkable the ways in which capitalism rewards capital. Money makes money for money. Now, that brings me to more or less my final remarks about how we move forward. We have long tried to beat white folks at their own game. And many Black professionals, from Mellody Hobson to Oprah Winfrey, to some of the most successful in our community, have certainly risen the ranks of successful and wealthy Black folks, from asset managers to celebrities and philanthropists. But we can't win at that game. We cannot catch up with respect to how capitalism works. So we have to borrow a page from our past, which is to say that one of the things that not only sustained us, but helped us to thrive over the centuries is mutual aid, looking out for each other, doing the very things that the Black Women's Health Imperative does, but doing it at scale and with intentionality, and not losing people to the mythology that if you can put more money in your bank account, that Black people will win. No, in fact, you might win, but the Black community won't win. And as we move forward, the stakes for how we solve this problem will increasingly incentivize the powers that be, white folk, whomever it might be, to pay some of us off to convince the others that you can be just like me if you just work hard. We've got to let that narrative go. And here is the most powerful example of this. The vast majority of poor people in America are not Black people. The vast majority of poor people in America are white people. This system was not set up for everyone to be rich. This system was set up as a pyramid with a huge base of low-income people to power the wealth for a few at the top. If we just take that as fact and build strength in our communities, build our capacity to look out for one another, build our capacity to protest when we need to, whether it's local or national boycotts, when they just simply don't pay attention to our consumer spending, and listen to our younger sisters who are imagining a future that has never been. That will help us to chart a path to economic independence and growth that will not create billionaires in the Black community, but will create healthy, sustainable communities where we will have what we need for each other. Thank you.
Oh, Khalil,
Wow.
mic dropping. Oh, we appreciate your presence here today, sir. If you've got a question, put it in the chat. I want to be respectful of everyone's time. So feel free, Tiffany, let's round this thing out. We've got a couple of more amazing people left.
Absolutely. We're on the last leg of this 4x4. So we're going to bring to the stage Mia Keys, who is a health equity strategist that's going to walk us through some key points around economic policy is being a health issue and what needs to shift. Mia, the floor is yours.
Well, I really appreciate being here and thank you all for your continued energy and attention and just everything that you're giving and bringing to this conversation. I'd be remiss if I didn't say happy belated birthday to you, Dr. Muhammad. I mean, you've another round around the lane around the sun and such. So I hope you've brought that energy into everything that you're doing into this week. And speaking of this week, I'd also be remiss if I didn't conjure for the sake of this conversation, especially because I am tasked to talk about or continue the conversation of economics and health. I'd be remiss if I didn't honor the legacy of someone who has recently become an ancestor and whose name is likely familiar to all of us. And if it's not, it should be. And if it's not, there's no shame in it. But Alexis Herman passed away earlier this week, and she was the first African-American person, first Black person to serve as the U.S. Secretary of Labor, first Black woman, then therefore to lead the Department of Labor. And we can't have a conversation about health policy from an economic standpoint, from a socioeconomic standpoint, without talking about the health and well-being and leaders of those who have carried the torch. She spent her childhood and her young adulthood just really advancing economic opportunities and access to Black workers, to women workers, and those, and this is a direct quote, those who had been shut out of opportunity for decades, is what she said. And so I've been spending a few moments off and on several of these last days just thinking about the work that she levied. She was responsible for helping to advance 2 minimum wage raises in the late 90s and early 2000s, and was instrumental in moving forward major economic policy and therefore health policy, including the Workforce Investment Act, which focused opportunities on people earning lower incomes, right? And so I say all that to say, because we obviously stand on the shoulders of giants, and a lot of what we're seeing today is not unlike what our ancestors have seen before us. Our most recent ancestors, as well as those who have left us in an earlier time continuum, and so I feel really very, while I feel a major sense of urgency and vigilance, I also feel quite empowered about this conversation. You know, the thing about economics and health, there's obviously a connection. We can see it, we can feel it, but the science also confirms it that unemployment or socioeconomic status is directly tied to our health opportunities, or the health opportunities that are afforded to us, because we do have an employment tied and employment tiered healthcare system here in the U.S. We also know through science. I'm a researcher by training, and health policy wonk by choice. But we know what the science says is that socioeconomic status and everything associated with that, whether that's education and employment status, that's a fundamental cause of health, right? Because of the way that socioeconomic status constrains one group of people who have lower socioeconomic status compared to those who have higher socioeconomic status, and they are simultaneously privileged, right? And so when we just dig through all of that in terms of what that means for the opportunities that people are availed over time, we do know that we can never overstate the power of policy. And if we're talking about health policy, we're talking about economic policy. And if we're talking about economic policy, we're talking about health policy. They're one and the same. I also want to pick up on what Dr. Muhammad was talking about in terms of executive orders, but I want to remind us that we have not completely lost ground with respect to what's happening in the world, and certainly not within these 100 days, in the sense that, well, we've lost a lot of progress, but I'm hoping that we don't lose sight of the fact, that we're not completely distracted by the fact that executive orders are not law in the traditional sense, right? They are not edicts that have been adopted by Congress. They have binding authority, and while federal agencies themselves must follow them, they don't override existing federal laws. Executive orders, one way or the other, cannot preempt existing statutes. And although the president can tell a federal agency how to implement a statute, it's the courts that must weigh in on the lawfulness, right? While they descend from the executive branch, executive orders hold major influence, of course, on the nation's consciousness, and we see that through the media. We see that even in our conversations day to day. We're really very tied into, well, what is the president signed today? What is he saying? What's he talking about today? And let me tell you, if you've not read Sun Tzu, you need to. And if you've never read Toni Morrison, you need to, because in a lot of ways, the conversations are informative, but we can't be distracted. We cannot be distracted, and I'll tell you why. Because an executive order is usually something that, historically is levied during wartime. And I don't know about you, but my heart quickens when I know I'm at war, because I know that while these executive orders carry great harm, I know that the true and most sustainable weapon is partnership and standing firm against deprioritizing issues that are of major import to the communities for whom we care. And it's important for us to understand that we are at war, because then we can decide what side to stand on. The other thing to really be mindful of, and for us to make sure that we're conjuring in all of our conversations, is that what's happening today matters, absolutely, but we've got to be really very aspirational and future-minded, because and I'll also say this in the spirit of conjuring ancestors. I'm coming off of a bend of celebrating two people who have passed, who I consider mentors, who are not Black women. One was a white man, one was a white woman. And I'm so sad that the world has lost people like them. I'm so sad, especially for white people, that the world has lost people like these people who I mourn today. But I think to myself, I understand why we are the issues that we care for are under attack. And it's because the enemy, or those who don't stand for the thriving of Black women, of Black peoples, of peoples of color, and so forth, they understand that the nation is aging, right? So we were by 2050, we will have reached a populace of more 65-year-olds than we ever have. But not only that, we're living much longer, right? So we'll put a pin in that in terms of economic economic impact and workforce, especially in the caregiving space and the healthcare space. But by 2045, the nation will also have achieved majority minority population status, whereby white Americans become the new minority due to major declines in birthing and white birthing rates. And this is why, and I'm going to say this, and I want you to be careful of what you hear when I say this. This is why I'm not surprised about the constraints that we see around abortion access. Okay. This is why I'm not surprised that our fights against reproductive justice and about reproductive health and sexual rights remain as they are. Because understanding from various angles the task of the enemy is again really very important to place ourselves where we are in the 21st century. We're moving toward a browner nation. We're moving toward a nation with less white people, and white people feel the impact of becoming the minority. And of course, that's a conversation about power. And this is not demonizing people who are white, but it is now talking about the significance and historical power associated with numbers. So let me just put that there and come back to the conversation about workforce and what it means to be ushering ourselves or to be ushered in chaotically or otherwise into this new, this 21st century space whereby the American health experience is inescapably going to be impacted by as patients and aspiring patients who look different than the people who are caring for them. But with these, new executive orders, if the precedent remains that, so for instance, what's it called? It's called the Reforming Accreditation to Strengthen Higher Education Act, right? So that's one of the executive orders that Trump has signed. And what it does, at least from a healthcare standpoint, is it puts under review the Liaison Committee on Medical Education, which is, and for the doctors on the call, you know what this is. It's the accrediting body that's responsible for making sure that the MD behind your name holds weight. And it's the same body that accredits the graduate medical education, the GME programs, right? And so this particular executive order says, well, it will require actions to be taken against accreditation programs that engage in so-called unlawful discrimination and accreditation-related activities, those activities that exist under the auspices of diversity, equity, inclusion, belonging, and initiatives. So if that were to move forward in full effect, what does this mean for medical schools that are also at the intersection of being minority-serving institutions? And what does it mean for those students, those who are in the medical workforce pipeline? What does that mean for, I'm a mother of a 3-year-old boy. What does that mean for my boy who he's showing serious proclivities toward using his hands? He loves numbers. He's always pretending to be a doctor. What does that mean for someone like him? Will there be programs set aside for him or available to him to advance, because the world needs and is looking for Black boys, Black girls to become future health practitioners, right? And make sure that we're not underrepresented in medicine, right? And then if we were to think about such an executive order going into effect, then there are, of course, these trickle-down effects that we have to be mindful of in terms of teaching hospitals, right? Because what we know are that teaching hospitals are funded by medical schools. But what happens to those teaching hospitals and their patients? And we know where teaching hospitals are located in the world. What happens to those teaching hospitals funded by medical schools who are undergoing an accreditation scrutiny because of their commitments to diversifying their medical education and their medical workforce? What then to direct patient care? So these are the situations that we have to be particularly mindful about. And the last thing I'll say, because it was also mentioned earlier, and I think it was Candace Bonthoro, you were talking about AI and healthcare, and my doctoral work focuses on congressional policy, health equity, and artificial intelligence. And so I spent a lot of time with members of Congress, with their staff, and various other leaders across the healthcare continuum just talking about AI, because there is an inevitability with respect to AI and precision medicine. But the thing across, and AI across pretty much every industry in the United States, but particularly with respect to AI and healthcare, healthcare is highly regulated, unlike so many other industries in the world. But what we are seeing is a major deregulation in terms of healthcare, which means for AI and AI developers or tech companies or tech oligarchies, frankly, they're coming in and they are the ones who are gleaning the ears of members of Congress, who have the major ear of the executive branch, and it's their influence and thereby their power, which will reside with the few. And so there is a major urgency that ought to reside in us, and look beyond the valence of, okay, he signed an executive order that, and I know what it means immediately, but what does it mean really, what does it potentially mean in the long term, and what can I do about it? Well, for one, be dogged in your approaches and to members of Congress. Know the names of those legislative assistants who carry on the work of that member, because that's really where the work resides. I'm a former chief of staff and health policy advisor to a member of Congress. I know who does the work. You have to call those who work for these members and ask for the names of those staffers handling health, handling economics. Email them early and often. Call them on the phone. Yes, do you know your representative? If not, make sure you do before you get off this phone. And I'm not here to tell you one way or another to vote, but I'll tell you that in terms of who's moving the needle, it's constituents who are voting and voting their members in and out of office, whether or not they're carrying the weight and the water that's responsible for really cooling us all off from what is taking us aback here. So
Thank
really
you,
appreciate
ma'am.
the conversation, and I'll pass the microphone, and thank you so very much.
I want to say that I think continuing the conversations about the ripple effect is really important, because even just the way you broke down from the accreditation to the teaching hospitals and I think a lot of people just simply don't know that. So thank you for all that you shared. Tiffany, we're gonna close this thing out with some strong, and please do not leave. We've only got a few more minutes, but our founder is going to round us out. So, but before that, who do we have, Tiffany?
We have licensed therapist Tori Dixon. We've heard a lot about mental health and the importance to protect and preserve ourselves while we do this work. So, Tori, we want to bring you to the stage to close us out around mental health. The floor is yours.
Good evening, everybody. I hope you all can hear me well. I want to say thank you so very much to Miss Lisa for inviting me to this amazing forum. I have learned so much. I am empowered. I am ready to go. It warms my heart whenever I get an opportunity to sit with amazing Black women who are doing amazing Black things and minding our own Black businesses and fixing everybody else's business with our Blackness. It always makes me proud to sit in this space and to talk to you about taking care of your mental and emotional wellness. One of the things that I talk about in my practice, where I see just about 98% of my clients are Black women, I have to remind you that although we are used to being the ship in these spaces where we are carrying the load, that we are in a season now where we're going to have to shift our position from actually being the ship to actually being the rudder. If you know anything about boats and how ships move, ships carry cargo, but there's a very small piece that's right beneath the ship that actually guides the ship where it's supposed to go. It's not the power steering, it's not the wheel of the ship. And as a matter of fact, it's not even responsible for the motion outside of itself, but it's a very small piece that if you are conscious and aware of having your own emotional anchor, you will be able to guide these spaces where they need to go. The thing about the guide is that the guide doesn't have to talk loud, it just has to move precisely. And when things are guiding you, it doesn't have to talk really loud, it doesn't have to say a lot. As a matter of fact, we know that much of what we know about ourselves is that we got it from an example, right? So you are what you see. You can't be what you don't see. And so most times as Black women, when we are guiding things, it's just a matter of us showing up. But in this season, when everything is tumultuous, when the government and the president is writing executive orders like you're writing checks, and you don't know which is what. You don't know who's telling the truth. You don't know what's right from what's wrong. It's going to be up to you to anchor yourself on emotional clarity, because emotional clarity is going to be the guiding force into how we move, into where we move, into what we do. Keep in mind that every chance that we have in this season, as things are moving and shaking, is not going to be an opportunity. Chances and opportunities are two completely different things. And for many of us, it's going to be important that we not pour our energy into fleeting chances, and that we are really clear on making sure that we are moving by guided opportunities. When I was doing this study, I was thinking about, I teach a Bible study, so I was thinking about the difference between what a chance is and what an opportunity is. And a chance, its etymology is Old English, and it talks about befalling you. A chance is something that just happens, whereas the opportunity is actually a nautical term, which brings us back to that rudder. The opportunity is a nautical term that says three things are happening: that this space is going to be the right fit, that it's going to be convenient for you, and it's also going to be in the right timing. So when we look at the word opportunia in its Latin form, it is actually a guiding term that means that the wind is in your sail so that your boat pulls up to the port without you having to do any sort of navigation. So as Black women, what I'm saying to you is that you need to turn yourself, you need to turn your emotion, you need to turn your mental and emotional wellness to the wind of the opportunity. Know when to hold them, know when to fold them, know when to walk away, and know when to run. That's from the prophet Kenny Rogers. The prophet Kenny Rogers told us we have to know where we stand in this thing, and that every fight that comes to you, sis, is not your war. There are going to be some times when you're going to have to just show up to the fight, and your presence alone is going to be everything that you need. It's going to be the power that's going to propel you into the opportunity to be successful. Sometimes you have to pick up your tools. Sometimes you have to have your tools. And in this season, your tools is going to be emotional clarity. Your tool is going to be community. Your tool is going to be your faith. Your tool is going to be your anchor. So sometimes you have to give yourself opportunity to pick up the tool. Sometimes you just have to give yourself the opportunity to show up. And sometimes you have to give yourself the opportunity to go somewhere and sit down, because that usually is the hardest part of the fight for Black women when it comes to reproductive health, when it comes to what happens in areas of AI, when it comes to maternal, when it comes to the assassination on our culture and everything else that is happening. The hardest part to do is to resist in your seasons of resting. Because what we tend to think as Black women is that just because we are resting, that our power is arrested. And you need to know that even in your seasons of rest, you are not arrested in your resting. You have a responsibility to use rest as a tool and as a power to unlock some things for you that may have been caught up in this season of things being blurry, in this season of the onslaught of information. You have to know that your rest is not arresting, and that it gives you power in this season in order to navigate the fight ahead. I want to remind you as a Black woman that if you are in any kind of fight, because what some of us are realizing is that this fight that we are noticing nationally is probably a microcosm, or our lives are microcosms of what's going on outside of us. So if you find yourself in situations where your own personal life seems to be marred and bombarded with useless information, it's time for you to shut down your social medias. It's time for you maybe to even shut down some social conversations. And it's time for you to get your house in order in terms of your information. It's time for you to lean into your rudder so that you can be guided into the safest places so that you are navigating in your own personal life what you are hoping to see outside of us. It can't be what it's not seeing in you. So if you are not calm, if your nervous system is off, if you need to speak to a therapist, if you need to take your anti-anxiety or your antidepressant or your ashwagandha or your magnesium, or if you need to go get your hormones checked, or if you need to go sit somewhere in the quiet, then I'm suggesting to you that before you fight for others, you do the work of resisting and fighting for yourself. Because at the end of the day, when you have given all you've given to the external fight, if you have nothing that's going to keep your rudder in place, you too will be like the ship without a sail and you will be moving everywhere as well. So let's get our own personal ships together. Let's decide what we are going to believe that's going to be the rudder that's going to guide us into the port where we need to go. And then we can take that movement and then it can be a part of the greater movement of our community, because there is no need to have an organized community when you have internal chaos.
Well, I'm speechless.
Listen,
Actually speechless, and that's hard to do. That's hard to do. Oh
an
my,
entire word.
that was, and the chat is just, yeah, all of that. Tori, that was an anointing you just put on us, quite frankly. And we appreciate that word because we know where that word came from. Okay. We're going to round this program out. I said it earlier tonight. She is one of my ultimate sheroes, and I am at this organization because of her. And she has been mentioned so many times tonight. Billy Avery, would you please come on camera and say a little word for us tonight?
Ah, okay. Let the church say amen. That was incredible. The whole thing. And Sister Tori, you brought it home. You brought it home to us. Be the rudder. Run your ship. Be in charge. I've changed the whole 3 times I've changed what I was going to say tonight. And so I think I'm just going to give you the topics of the 3 things I was going to say, because we are all running. I mean, it's the hour is late. The first thing, please know that we are all a part of the Black women's health movement. You think about movements, you say the civil rights movement, the peace movement, we have a movement. I was sitting here wishing that the 2,000 women who came to Atlanta in 1983, I wish they could hear what I heard tonight. We didn't have this kind of voice in 83. We didn't have the depth of this. And you all represent thousands of women who are working with you. So we are all revolutionaries. That was the first thing I was going to talk about. We are revolutionaries and we are waging this war and we are going to win. And I just thank all of you for your dedication. The second thing, and everybody has said some of the stuff I was going to talk about, sustainability.
Yeah.
Be well. Take time to rest. I learned this very early on when we were organizing. We got so excited. We were working 7 days a week. And after about 5 months, everybody was sick and tired and couldn't do this and couldn't do that. And we had to absolutely say, if you work on the weekends, you have to take off Monday and Tuesday. I don't want to see you in this office. Stay home, look at your navel, do whatever you need to do, rest, but we have to take care of ourselves because these are very difficult times and we have to sustain. And a movement is not a sprint. It is not a spark. It's a fire that burns. And it's going to be burning for a while. Let's keep it burning. And the last thing I want to do is read from the Bible according to Billy Avery, the author of Words, on activism.
Nice.
And I leave these words with you. And I'm not going to read the whole thing for sake of time, but I want to just commend all of you for being activists. And I appreciate you. And I love you. And I love seeing people who I saw when they just got started in their organization. And now look at them making changes. Keep it up. This is what it's about. And remember, we have to have all of our sisters at the table. The table is not complete if you don't have the diversity of who we are in terms of income, in terms of age, in terms of sexuality. Bring in the voices of the lesbians, bring in the voices of the trans people, bring in everybody's voices, because that is how we affect lasting change. Activists help to make the world a better place. Many important changes have been made because something clicked and made people see a picture more clearly, focusing on the vision of what could be and how changes can lead to a better society. We must celebrate our activists. So protect your joy, find your joy, party, play hard, work hard, have a good time, enjoy yourself, okay? We are trailblazers who are not afraid to speak out, stand up, and challenge the status quo. We do our work today so that we can create a better place for others tomorrow. Activism leads and inspires change. The activist passion provides a driving force for all of us. As you place activism on your altar, think about and feel the passion of the issue that is important to you. The affirmation is, my actions are important and inherently powerful. The quote is, dissension is healthy, even when it gets loud. And you know we Black women can be loud. So be loud, be out there, be brave. I love you all. Keep up the good work. You are fantastic.
Billy, what an absolute beautiful closing to our, I can't even call it a program. This was a convening. This was, I had slipped my shoes off earlier because Billy always says if you can slip your shoes off, slip them off.
Right.
But thank you for your leadership, your mentorship, and we heard you loud and clear. Tiffany, I just want to say you have been an amazing co-host. I want to shout out our Rare Disease Diversity Coalition, who we were at the Capitol Hill with today. Our policy team, again, has just been amazing. We are doing once a month, we have a policy newsletter called the Policy Imperative. So if you all don't want to be bombarded by everything on social media, it's great that you can tap in to once a month. Our regular newsletter will be the Policy Imperative. So make sure that you tell some friends, right? We want to make sure that the Black Women's Health Imperative, who is truly the only organization in this country doing this work on this comprehensive level that we are doing it, from the policy advocacy, the research position, we are the only organization steeped in all of the causes, right? All of the health disparities, or the issues that affect our health the most. I want to shout out our chronic disease team. You know, we have been working with, you know, preventing diabetes and pre-diabetes and management of diabetes for over 12 years with the highest rated performing program from the CDC. We just put in the work every single day. But what Michelle said earlier in this call is so true. We've got to make sure that people know about the Black Women's Health Imperative, about the Black Mamas Alliance, Mamas Matter Alliance, about In Our Own Voice, because times like this, we're going to have to tap into our entire network to keep our organizations uplifted. So our charge to you all tonight is to definitely take us with you tomorrow, next week, next month. Everyone should know about these organizations. Everyone should know about the Black Women's Health Imperative. We should be as known as Essence Magazine because we are working on behalf of you all day, every day. And we will not stop. Billy won't let us. Billy won't let us. Tiffany, close us out. And I know we have some resources that we are going to uplift to everyone. So if it was mentioned tonight, we'll probably have it in this resource kit. So all of the websites and different things, we'll make sure that we get most of that in our post-event resource guide. Tiffany, close us out.
Absolutely. You know, there's not much more to say beyond thank you and ashe. It is so, right? So much has been shared. The resources will be circulated afterwards. We are energized. We are full. We are equipped. We are called and placed at this moment in time to carry this work forward. It's been an honor to serve as your co-host. We have our takeaways and our action items to keep the movement going. Thank you all. Thank you to the Black Women's Health Imperative for creating this space, creating this room. And thank you all for staying in this room and equipping yourself with the fuel and the tools. We are moving from being a ship to a rudder.
To a rudder. Thanks,
Thank you.
everyone.
Thank you.
Okay. Good night.
Good night.